I chose the topic, the effects of trauma on adolescent mental health. My name is Emma Bennett, my net ID is ELB99, and my student ID number is 3962504. These are a few definitions. The first one regarding mental health, specifically in adolescence. It can be defined as the capacity to achieve and maintain optimal psychological functioning and well-being. And a traumatic event is one that threatens injury, death, or the physical integrity of self or others, and also causes horror, terror, or helplessness at the time it occurs. These are some quick facts about mental health in adolescence. Suicide is the third leading cause of death for teens ages 15 to 19 years old. Half of all mental health problems start at the age of 14. Depression is considered to be one of the leading causes of illness among adolescents, and the risk for depression increases with age across adolescence. In recent years, we're seeing a reduction in the emotional well-being of adolescents, but this can also be due to a decrease in stigma surrounding mental health disorders and an increase in adolescents who seek help. Some common types of disorders. In general, in adolescence, it's most common to see depression, anxiety, and eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorders. Specifically after a trauma, we still see depression and anxiety, but then we also see more behavioral problems and PTSD. So why are adolescents more at risk for these mental health disorders? As we discussed in class, there's a pressure to fit in with their peers, and being slightly different may cause them to have an increased risk of developing a mental health disorder or having negative feelings about themselves. There's also stress with school and pressures to conform to the ideas that they have for themselves in the future and the expectations of their parents. There's also an increased access to the use of technology and media, and as we discussed in class, the media can negatively affect the mental health of adolescents. There's also a desire for greater autonomy, and there's stigma and discrimination with ethnic groups can increase the risk for depression. These are some examples of traumas that adolescents may experience: natural disasters, sexual abuse, domestic violence, motor vehicle accidents, medical traumas, loss of loved ones, and war experiences are all a list of examples of trauma. So reactions to the trauma can vary depending on age, development, race, ethnicity, and available resources. Boys are more likely to act out and show behavioral problems, whereas girls are more likely to internalize and feel guilty about the trauma. Wealth is considered to act as a protective factor for children. Children from higher socioeconomic status are less likely to experience the trauma and less likely to develop a mental illness as a result of the trauma. There are also cultural differences in the way different ethnicities interpret mental illness and thus how they seek treatment. Different ethnic groups may also face language barriers that can decrease the quality of the care they receive when they do seek treatment. And as I said before, the risk of depression increases with age throughout adolescence. So these are some common side effects we see after a trauma. There's a development of new fears. These adolescents can experience separation anxiety, an increase in sadness, a loss of increase in their normal activities, which can be bad because there's a large need to contribute in adolescence and stay connected to their peers. There can be a decline in schoolwork and a decrease in concentration, which we also talked about as a risk factor for depression. And these children are more likely to be angry and irritable, and they can experience sleep disturbances and nightmares. So what can be done about these problems? Early detection is really important in these situations so that treatment can be implemented as soon as possible. There should be counseling services provided for these children and interventions that target multiple health problems instead of just one. The delivery of these interventions should be done by trained medical health professionals, like counselors. And these counselors should also be familiar with the child's individual case so that they can tailor the treatment based on that child's needs. They should engage and empower the caregivers to be better equipped to support the child, and medication should be provided to the adolescents that need it. And these are some sources that I used throughout the presentation. Thank you.